Well, hi there, Christopher Westfall here with an update on what's happening with Medicare. This is October 2021. This is straight from the newswire from the American Hospital Association and what they have to say about Medicare Advantage. Now, I'll let you know that I'm a Medicare insurance broker. I specialize in the world of Medicare. We do Medicare supplement insurance, Medicare Advantage, Part D drug plans, all the rest. But there are some things that are greatly lacking in the sales presentations from these commercials and from agents who are pushing Medicare Advantage plans without what I call full disclosure. They're not letting you know the downsides of those mostly free HMO plans that have no monthly premium whatsoever. And it's that very reason that I come to you with updates about Medicare Advantage, because there's just a huge gaping hole of information onto the downside of what those plans can bring to you. So we help people in here all the time with both types of insurance, Medicare Supplement and Medicare Advantage. But we tell everybody the whole story. As the old broadcaster used to say, the rest of the story. So with that in mind, you won't see this from most Medicare Advantage salespeople, especially those that offer nothing but Medicare Advantage, which seems to be the growing trend. So I want to bring you what's happening in the world. This will pop up on any news search that you do for what's happening in the world of Medicare. However, you won't see it from others. So I want to bring it to your attention today. This is an announcement that came out from the American Hospital Association, again, October 18th, 2021, when this came out. It says the AHA urges CMS, that's a Center for Medicare and Medicaid Services, to address prior authorization issues affecting Medicare Advantage patients. Stick with me. There's some good stuff in here that's not just talking about prior authorization. This is talking about many issues with Medicare Advantage that the hospital systems are finally addressing, and they're doing it head on. This is some interesting stuff in here. They're writing to the new administrator for CMS, Ms. Chiquita Brooks LaSure, and this is the highlighted portion. I won't take all your time to read every bit of it. But anyway, on behalf of 5,000 member hospitals, 270,000 affiliated physicians, and 2 million nurses and other caregivers, the AHA writes to offer our recommendations, they say, on how CMS should revise and reissue recent proposed regulations streamlining prior authorization, a huge ongoing problem with Medicare Advantage. Prior authorization, I'll explain what that is and how it impacts you in a minute. To ensure benefits extend to patients enrolled in Medicare Advantage. Consider additional regulations to limit care delays, another big problem with Medicare Advantage. I'll get into that in a second. Conduct oversight and enforcement for plans who have demonstrated problematic prior authorization usage in the past. Now, what is prior authorization? I've covered it before, but important for you to know when you're getting into a Medicare Advantage plan that you are getting a managed care plan, as opposed to original Medicare, where if your doctor says you need it and it fits Medicare guidelines by being medically necessary, you get that treatment. Doesn't happen that way in the world of managed care.
One patient who had a stent put in for a heart attack to open up their blocked blood vessel, saved them from their heart attack, and a really good result. We recommended a particular medicine called Brilinta, which is a newer medicine to prevent the stents from closing, but is also more expensive. No one knew at the time that it required prior authorization, and the insurance company didn't allow the prescription to be filled. No one actually contacted the healthcare team to say this wasn't filled. So the patient didn't have his medicine. As a result, the stent that was just put in closed off. He had another heart attack. We were just stunned and frustrated because we did everything we could to help this patient going forward. We had thought he was on the evidence-based appropriate treatment, and then lo and behold, a week later, he's back with a heart attack, and we couldn't figure out what happened. And he told us I wasn't taking my medicine because it wasn't approved by the insurance company. It was shocking. It was devastating to everyone on the team.
Prior authorization, it says, is a process whereby a provider, on behalf of a patient, requests approval from the insurer before delivering a treatment or service. Although initially designed to help ensure patients receive optimal care based on well-established evidence of efficacy and safety, many health plans apply prior authorization requirements in ways that create dangerous delays in care, contribute to clinician burnout, and drive up costs for the healthcare system. One of the most frustrating aspects for providers and patients is the variation in prior authorization submission processes. Plans vary on how they implement this. As a result, now this is interesting, the prior administration tried to address this with CMS. As a result of the administrative and clinical difficulties caused by inefficient prior authorization processes, Hospitals and other providers were pleased when last year CMS took action to streamline prior authorization through the reducing provider and patient burden by improving prior authorization processes and the promoting patients' electronic access to health information. It was a rule. And that was released December 2020. Now, it hasn't been finalized yet. And when it does, it will streamline a lot of this problem going on with prior authorization. However, the weird thing is, the insurance lobby in Washington is really, really powerful. And they got in there and they snuck into this regulation and said, you know what, that's good for all commercial plans and individual managed care plans, but let's just carve out Medicare Advantage organizations. That's literally what happened. Go down to the next highlighted portion here. The notable exclusion of Medicare Advantage organizations is extremely troubling and significantly reduces the potential impact of the regulation. Notice this is the only part that's in bold so far. Exclusion of Medicare Advantage. How did they get that done? The proposal establishes that impacted plan beneficiaries, that's you, the senior, including those belonging to managed care plans, would experience improved efficiencies in the manner in which they're receiving care by reduced timelines waiting for treatment and procedural improvements. By excluding Medicare Advantage organizations, the agency would be withholding these benefits from many Medicare beneficiaries. Currently, approximately 1/3 of all Medicare beneficiaries are enrolled in Medicare Advantage organizations, with the Congressional Budget Office predicting this percentage to increase to approximately 47% of seniors by 2029. In bold again, in order to promote procedural improvements and prevent negative health outcomes associated with delays in care for all beneficiaries, we urge CMS to require Medicare Advantage organizations to adhere to the regulations set forth in this proposal. Including them would also reduce administrative burdens and cost to providers as well. It would have less variation among health plans. Now, skip to this part. Reducing prior authorization timelines. So there's a problem when you're sitting in a hospital and you're waiting for a health plan to do what your doctor says you need done. I don't know if you've experienced this before or not dealing with managed care, but it can be hell on earth. If you're in pain or you're suffering from an infection and there's a course of treatment that your doctor says you need to have done, if you were in original Medicare with a supplement, you would go have it done same day. Managed care, Medicare Advantage, maybe not, depending on your specific plan. And there are thousands of different plans across this country. There's no set common denominator for Medicare Advantage plan like there are finite set in stone plans and Medicare supplement. They go on. Unlike other transactions between a provider and a health plan, prior authorization involves clinical information and has a direct impact on prospective patient care. A prior authorization request is often the final barrier between a patient and the implementation of their provider's recommended treatment, making judicious processing of such transactions extremely important. It's important to get this done quick. They're in pain. Research has shown that prior authorization procedures cause significant delays in care. That's what I covered before, frequently leading to negative clinical outcomes in patients. Current CMS rules allow Medicare Advantage organizations to take up to 14 days to respond to a prior authorization request. 14 days. That's insane. During which time a patient provider is uncertain as to whether their planned treatment can go forward. This delay in patient care is both unnecessary and unacceptable, the American Hospital Association says. In many cases, the patient is in the hospital awaiting transfer to the next site of care to continue their treatment, such as inpatient rehab. These patients can sit unnecessarily in hospital beds for days or even weeks as Medicare Advantage organizations process the prior authorization request. Ain't me saying it, it's the American Hospital Association saying it. This is what's going on. It's really happening across the country. And I'm probably the only one to tell you this. These delays can not only contribute to a degradation of the patient's condition, but they can also waste costly health system resources, preventing hospitals from freeing up inpatient capacity, as we issue an issue that we return to again below. and increase the patient's exposure to hospital-based pathogens. Ever heard of somebody going in the hospital and they were fine first for whatever procedure, then they got sick based on something in the hospital? Well, if you're sitting around for weeks, that's more likely to occur, isn't it? In bold, we recommend that plans be required to deliver prior authorization responses within 72 hours for standard, non-urgent services and 24 hours for urgent services. Wouldn't that be great if Medicare Advantage plans were treated the same way as commercial health plans? They're also asking for increased plan oversight and enforcement. Medicare Advantage organizations have an established history of inappropriately utilizing prior authorization to delay access and deny necessary treatment for patients. Let me read that again, folks. Medicare Advantage organizations have an established history of inappropriately utilizing prior authorization. Why? To delay access and deny necessary treatment for patients. How much clearer can it be? According to a 2018 report by the Department of Health and Human Services Office of Inspector General, of which we have a video on, I'll link in the top of this if you can see it on your screen, 75% of Medicare Advantage prior authorization and claim denials were overturned when appealed by providers between 2014 and 2016. 75%, if the person was strong enough and stuck around long enough to say, I want to appeal this denial of my health care. 75% instantly turned around. As a result of these findings, the Inspector General recommended increased oversight of Medicare Advantage organizations' prior authorization processes in order to ensure that beneficiaries could access appropriate treatment in a timely manner. What's happened since then, 2018? Well, the COVID-19 pandemic has manifested the widespread and inappropriate usage of prior authorization, particularly in regard to the patient transfer to post-acute facilities. As the pandemic surged, hospitals have reported extreme delays and difficulties in transferring patients to skilled nursing facilities and other post-acute care sites despite clear clinical justification and appropriate authorization request. This process has prevented acute care beds from being freed up to care for incoming patients, compounding the issue of overcrowded acute care facilities. All this is taking place as health plans are posting record profits. Additionally, despite clear CMS guidance on the matter, Medicare Advantage organizations frequently established overly stringent medical necessity policies that prevent patients from obtaining necessary care. As CMS established in its recent Medicare Advantage Health Plan Management System memo, although Medicare Advantage organizations, quote, are not required to follow original Medicare's documentation requirements or policies for establishing medical necessity, the methods implemented by Medicare Advantage and their contracted providers to determine medical necessity cannot result in coverage standards that are more stringent than standards that apply in fee-for-service or original Medicare. Insurers frequently disregard this guidance and create obstacles to patient access to various services. For example, the medical necessity determination needed to admit a patient to a hospital is often a significantly higher threshold for Medicare Advantage as compared to the 2 midnight rule that CMS uses for regular Medicare. Health plans frequently deny hospital requests for patient admission, despite having met the 2 midnight criteria and having clear clinical justification for inpatient care. This denial forces hospitals into a precarious situation, and they must admit the patient and hope to win on claims appeal or delay patients from medically necessary care while they navigate the plan's prior authorization appeals process. Medicare Advantage. Meanwhile, the decision can have very real implications for patients, including in how much they owe in cost sharing. Indeed, 2 identically situated patients, one in original Medicare, the other in a Medicare Advantage, can have very different coverage and cost-sharing obligations if the Medicare Advantage organizations determines that the stay was observation, but fee-for-service Medicare deemed it inpatient. The American Hospital Association urges CMS to rein in this inappropriate health plan usage of roadblocks that delay access to or jeopardize coverage for essential care. At the end here, in order to protect the millions of patients utilizing Medicare Advantage plans, we urge CMS to establish increased oversight and enforcement of Medicare Advantage plans, with particular focus on eliminating unnecessary care delays and inappropriate denials caused by prior authorization usage. Specifically, we encourage CMS to start by better tracking plans' use of prior authorization, as well as the result of plan prior authorization decisions. This would require plans to report distinct data on prior authorization versus reporting all types of requests together. CMS should require that this data be submitted monthly to enable timely oversight and penalize plans that fail to validate the data, such as through increased risk of audit. Finally, and most importantly, CMS should use this data to identify outliers, those plans with disproportionately high usage of prior authorization and those with high rates of adverse determinations overturned on appeal for audits. That's who they should single out. This oversight would help fulfill the Office of Inspector General report recommendation and help providers deliver timely and effective care that Medicare enrollees deserve. So, Medicare Advantage salespeople will always say that Medicare Advantage covers everything that original Medicare covers and gives you all this extra junk, all these extra things, free meals, rides to your doctor, dental care, which is not comprehensive, all this kind of extra goodies on top of what original Medicare will cover. And that, ladies and gentlemen, is a bunch of bull. They do not cover the exact same things the same way that original Medicare does. Here is about the 200th example that I brought on my YouTube channel, just for those people who are paying attention. There's a huge difference in Medicare Advantage and the managed care that they're allowed to manage on your behalf in order to, as the Office of Inspector General said, increase profit, because they're given a finite number of dollars from the U.S. government. And every time they don't spend all that money, they keep the difference as profit. Big difference there. Original Medicare is something that you've paid into your entire working life. You earned it. So when you have Part A of Medicare covering you in the hospital, Part B of Medicare covering everything outside the hospital, you put a drug plan with that. Those are the benefits that you've paid into and you've earned your entire life. When you go into a Medicare Advantage plan, you cannot then walk into the doctor's office or into the hospital and say, here's my Medicare red, white, and blue card. I'm on original Medicare. My salesperson told me I was. Let me get into that hospital with just one small copay. Nope, can't do it. Why? Because you're not in original Medicare. They'll tell you, no, you're in a Medicare Advantage plan. You got to go call the health plan and see what they're going to approve. Then they start this clock and they have 14 days to approve whether or not you need something that might be an emergency or an urgent situation. You need something for pain relief or to mitigate an ongoing infection or get you transferred into a different care facility that's better appropriate for you. All those things are going to walk through a whole bunch of hoops and red tape. But sometimes you get what you pay for. I'm Chris Westfall. For more updates on Medicare as they happen in real time, please make sure you're subscribed to this channel. If you have a friend or a loved one who's turning 65 or just starting their journey on Medicare, they're considering where to go, and you want to give them a recommendation of someone who will tell them the truth, give them both options and let them pick based on full disclosure and all the information that's available, please have them contact our office at seniorsavingsnetwork.org. It may not be pleasant, it may not be fun, but it's the truth. And that's what you're going to continue to get from me. I'm Chris Westfall. God bless you. Thanks for watching. Oh, and stick around. I'm going to show you what doctors have to say about prior authorization in their own words. Take care. Bye-bye.
Prior authorization is a nightmare.
It cripples my patients, it cripples my medical practice.
It takes a lot of the joy out of medicine.
The amount of time that it takes myself and my office staff to go through that process now for almost every prescription we write has gotten to be an enormous problem both for us and for our patients. They're spending something like 15 hours a week per physician just filling out these forms and waiting on hold for the insurance companies.